Hi everyone, my name is Julia Thorpe, and this is my presentation on chorionic villus sampling, or CVS. So what is chorionic villus sampling? CVS is a prenatal test. It is conducted in the first trimester between weeks 10 and 13 of gestation. It detects and diagnoses chromosomal, genetic, and metabolic abnormalities. So, the history and development of CVS. CVS testing has come a long way since its development. In 1968, Dr. Moore in Scandinavia performed the first CVS transcervically. However, significant complications associated with this procedure led him to abandon it. Then in 1975, CVS was reported to have been used in China for sex selection prenatally. However, there was limited access and use of it, therefore, the results were not reproducible and it was once again abandoned. Then in the 80s, major advances in ultrasound technology and molecular genetics paved the way for new CVS research. In 1983, Dr. Brambati in Milan conducted ultrasound-guided CVS, achieving a 96% success rate, which allowed him to prepare samples for chromosomal and biochemical analysis. Then in 1984, the transabdominal approach was first performed in Copenhagen. This is where it was realized that this is the safer, more preferred method. And then since the 80s, CVS has now been accepted as a prenatal test that can be done, but it is not routine as much as it was routine in like the 80s and 90s. We have now kind of steered away from that due to advances in technology. So, who recommends and supports CVS? Major organizations such as the American College of Obstetricians and Gynecologists, Society for Maternal Fetal Medicine, American College of Medical Genetics and Genomics, the World Health Organization, March of Dimes, American Pregnancy Association, they all agree and rule that this is an appropriate and safe test to be done. However, it's by no means necessary and really only recommended when indicated and needed. So, what does it exactly test for? It can test for chromosomal disorders, single gene disorders, and metabolic or enzyme disorders. So, chromosomal disorders would be things like Down syndrome, Edwards syndrome, Pateau syndrome, Turner syndrome. These either have an extra chromosome or missing a chromosome. And then there's structural abnormalities like deletions, duplications, or translocations. Then single gene disorders would be disorders such as cystic fibrosis, sickle cell disease, Tay-Sachs, thalassemia, muscular dystrophies, and any other inherited metabolic conditions like these. And then for metabolic or enzyme disorders, this would include things like lysosomal storage disease or disorders affecting the metabolism of things like amino acids, peptides, organic acids, carbohydrates, and fatty acids. So, in regards to sensitivity and specificity, most studies state that CVS is 99% accurate. However, most of the articles and tests that have been done are really based in like the 90s, and more recent research is now focusing more on non-invasive tests. So, the recent studies still show that CVS is very accurate. However, it's just not used as frequently now. It's not required, it's not routine, and it's just really not as common as it used to be. Non-invasive tests are becoming more accurate, with 98 to 99% accuracy, making, like I said, CVS less common. It's offered to patients based on indications, but it's really left up to the patient, to decide when they are educated on what this test provides. So, indications for this test would be, for example, non-invasive prenatal testing or NIPT, typically done in the first trimester, comes back positive, um, indicating that they're either at high risk for it, so they are recommended to get this testing done, or if there is a family history of disorders. Um, If the mother has previously had a child with any genetic or chromosomal disorders, they are at higher risk for having another child with with a defect. Um, Older women are at higher risk for having a child with a chromosomal or genetic disorder. Therefore, they're recommended to get this testing. If there was something abnormal on the sonogram, it's also recommended that they get a CVS to check. And then finally, obese patients are at higher risk for having a child with a defect. Therefore, it's recommended that they also get checked. Um, in regards to contraindications for this test, there are many reasons why it would be recommended that a mother get not get this done. However, most of the time it's left up to the provider and the patient to kind of decide whether or not the risk versus reward is worth it. For example, if a patient has maternal alloimmunization, the patient may need to receive RhoGAM before the procedure because there's a possibility of cross-contamination of blood during the procedure. Additionally, if the mother has is positive for something like HIV, Hep B, Hep C, or has a vaginal infection, these can all put the fetus at risk for being exposed to those infections. So precautions should be taken, and it should be known whether the mother is positive for any of these things. And then also things like having an IUD still in place, if there's cervical stenosis, uterine myomas, bowel adhesions, or a complicated positioning of the placenta, these all need to be taken into account and looked into before conducting this procedure. And then finally, if there is any vaginal bleeding or subchorionic bleeding, that is also taken into account. So the procedure for this test, whoever is conducting this test, they need to be specially trained and it should be done in facilities with appropriate resources. It can be done one of two ways, transcervically or transabdominally. Transabdominally is the safer route, but both can be done. No matter which way it is done, though, the person performing the procedure will be conducting it under continuous ultrasound guidance. Um, Transcervically, there is a catheter that is inserted into the vagina and then the cervix, and the catheter ends at the edge of the placenta where they can use a syringe to suction and collect a sample that way. And this is mainly used when the placenta is located either posteriorly or it's in a place that you cannot access when going through the abdomen. And then transabdominally is when they insert a needle into the abdomen directly into the placenta where they can aspirate the sample. So advantages and disadvantages of this test, most of them are related to um, if comparing them a lot to amniocentesis. So advantages are this is done in the first trimester compared to amniocentesis are not done until the second trimester. So you get results faster, there's shorter waiting times. So if the tests come back negative, there is decreased in parental anxiety, but also if the tests come back positive, they can know sooner in the pregnancy whether they would want a possible abortion or what they would want to do with these results. And then there's also, it's very accurate, so that's another advantage. Disadvantages are there is slightly a higher risk of fetal loss than with, say, amniocentesis, um, all the risks that accompany the procedure, which I'll go over in a later slide. And then it does not test for neural tube defects like amniocentesis do. And then additionally, it is a painful and uncomfortable procedure. So results, they come in a couple different options. So karyotypes, which is a chromosome analysis. This is a standard test. This takes about 1 to 2 weeks for results. This tests for chromosomal abnormalities. There's also a faster rapid test called the FISH, where you can get results in 1 to 2 days. This tests for common chromosomal abnormalities such as Down syndrome, but sometimes these are a little less accurate, which is why the karyotype is the preferred and more standard test. And then also genetic mutation testing, which tests for inherited conditions such as cystic fibrosis and sickle cell. And then it will show a positive or negative for the mutation, and it will show if the fetus is a carrier of the gene, affected or unaffected. So, interpretation of findings, it is a diagnostic test, not just a screening test. Therefore, it will identify exactly what the baby is positive for. Karyotype is the standard test, just like I had mentioned earlier. The provider will need to order additional tests if there are concerns for certain defects or mutations. Normal chromosomes are 23 pairs, totaling 46. In instances where a genetic condition is present, an additional chromosome may be detected. So, interpreting findings, for example, say we have a mother who their fetus tests positive for Down syndrome or trisomy 21, it would show up on the karyotype. So for a typical fetus, there would be 46 chromosomes present, which you see on the left side. And then in a patient with Down syndrome, there would be 47 chromosomes present, and specifically in this case, instead of a single pair or two chromosomes for 21, there are actually three. So when looking at the results for, say, a normal female baby, there would be 46 chromosomes and it would be double X because it is a female. And now, say you get a Down syndrome female, it would read 47 chromosomes and still double X because it's female. But then you see plus 21 because there is an additional 21 chromosome. So results of a CVS, you either would get no abnormality detected, or if there is an abnormality detected, they recommend an amniocentesis in the second trimester. So when the amniocentesis is done, it can confirm whether there was confined placental mosaicism, which is when the abnormality was solely in the placenta. So when the CVS was conducted, they only collect placental cells. So then it might not have transferred to the fetus, and the amniocentesis at this time would be able to detect if the condition is actually in the fetus. And then also there's the option of maternal cell contamination mosaicism, which is the cells were contaminated by the mother's own cells, which means that it was, I guess you could say, a false positive. So, client teaching and counseling, the main things that you need to discuss with the patient would be why the test is being recommended, what it tests for, what the test and the procedure entails, possible risk factors and side effects, when they should expect to receive the results, a possible referral to a genetic counselor, and then possible follow-ups if needed. Specifically, I would say you will receive the test results in about 10 to 12 days. There's no special preparation needed for this test. Afterwards, avoid any heavy lifting or strenuous exercise for about 24 to 48 hours. Rest after the test. There will probably be some mild cramping, which is a common side effect. And then make sure to call your provider if you're experiencing any heavy bleeding, severe abdominal pain, fluid leakage, or fever after the procedure. And then well, they're not common, but known risks of getting a CVS, they're not very common, but they do need to be talked about with the patient. The most concerning one is fetal loss or spontaneous abortion. It is fairly rare, but it is a possibility. Infections, fetal growth failure, premature rupture of membranes, vaginal bleeding or spotting, limb abnormalities, subchorionic hematoma, preeclampsia, and cervical shortening. And then these are all of my references. Thank you.